other services and give a very high level overview. Sherry?
There's a question in the chat you might want to just
Oh,
address quickly before you move off of food.
a
Adam
backpack
asked
program.
if we have a backpack program. Right. So yeah, there we go.
Yep, and as Monica shared, yes, we have Pack-a-Sack that we're distributing to middle schools and after-school programs. We also are doing sort of an ad hoc high school snack program. We learned from schools, particularly for students, high school students who were not doing remote learning, were having to go into school because they don't have the capability at home for remote learning, or their parents are essential workers. They can't, educate them from home. So they are in school. There was this gap in, they were able to get breakfast, but then there was a huge gap of time between, and I don't think they were receiving lunch. I think that program went away. So students were getting breakfast in school all day and no other nutritional supplement, and then going home where there may also not be adequate food. And so we launched a program just to provide healthy snacks to kind of bridge that and to get them through the day. So string cheese, apples, water, and have been delivering that to a series. Monica, how many schools are we serving?
7 or 8.
7 or 8. Mm-hmm. And so again, really just being responsive. This came up from, one of our contacts at the school called us and said, this is a gap. It's kind of strange. We know you don't really do this, but can you figure this out? And I think that's been kind of our mantra, especially this last year, is yes, we can figure it out. If there are families or kids who are hungry, we can figure it out. We are still doing Pack-a-Sack though, in the way that we traditionally had, just on a smaller scale. And that's where we pack the pre-packed, packs of food that go home with students over the weekend so that they've got food on the weekend. So just briefly to give an overview of what's happening in our health center and in our residential programs. Our health center at the beginning of COVID, and you all may know this from reading our newsletter as we've kept you updated on what things are looking like. We did close our actual clinic for a brief period of time because so many of our providers, as you all mentioned earlier in the call, if you were of an age that was considered at risk, staying safe at home was the thing that had to happen in the early days, in particular of the pandemic. And so that impacted about 80% of our providers in the health center. And so what we did is we decided to go to telehealth until we could figure out how to safely open our doors, until we had all of the requisite PPE available, to invite our providers back, to have our staff safely serve clients in that really high touch environment. WeHelp has its own set of risks where you're still interacting with people, but you are outdoors. It's not that really close, prolonged contact. But as you can imagine, in a clinical setting where a nurse or a doctor is sitting in an exam room and doing an examination, that is a higher level of risk. And so for the 170 existing patients that we had at the time that COVID began, we kept them going via telehealth with their prescriptions, consultations, and the capability to consult with a nurse or a physician via phone or via telehealth. We're now still doing telehealth. We're excited about that. On the one hand, we weren't ready for it. On the other hand, we had to figure it out and put something in place that we probably maybe should have been doing anyway. And so in that way, COVID kind of forced an enhancement that now we've been able to keep going. But we are now back open and have been for many, many months, seeing patients in our health center. We've seen some growth there in our patients served, even with our number of providers still being relatively low, because many have opted to continue to stay safe at home until they are vaccinated and it's safe to come back in. I was reading an article that Deloitte, a white paper that Deloitte published a little while ago about the top 10 innovations in healthcare. And I was happy to see that 3 of those, the free clinic actually has and does. And so one of those is telehealth, as I just mentioned. The other is sort of a point of care diagnostic. And as a result of a grant that we got about a year ago, we were able to put in a piece of equipment that allowed us to read labs right there on the spot quickly. You put it in a little device and it spins out the blood, and then you get this report immediately. It's very, very cool. So we got a whole diagnostic on a patient right there when they were in the office, as opposed to having to send the lab out to St. Anthony's, wait for the return, call the patient back. And so that little tiny machine, that little enhancement has really helped with our efficiency and capability to help patients more. And then finally, another enhancement cited by Deloitte is 3D devices. Now this one is really cutting edge. So in our dental center, because we have a donor who is incredibly passionate about dentures, funded in full our capability to implement a 3D printer that produces dentures. So it's our digital denture lab, where we can produce dentures on this 3D printer in half the time and at half the cost. And without the yucky mold, that you have to put in your mouth and set, and, takes a lot of time. So we're really excited about that. We just dedicated that lab last month and are in the process of bringing patients in to provide dentures to them via this new innovation. And so even amid COVID, even amid all of the challenges, figuring out how to get our hands on PPE and keeping people safe, we've managed to implement these little enhancements that we know are really going to help us and our patients going forward. We've also continued to expand our drug assistance program, which is the program where we're able to provide prescriptions at no cost to patients who otherwise would not be able to afford those drugs. Insulin is a big one there. So we're able to make sure folks have access to no-cost insulin to keep their diabetes managed. And then we also continue our diabetes education management program, which is a specific education-based program for patients with diabetes, where they're able to meet with a healthy living coach one-on-one on a regular basis, to do meal planning, to get labs, and to over time behaviorally work to lower their A1C so that they don't become insulin dependent. And so we have kept that program going as well. And we're just looking forward to, our whole health center staff now has been vaccinated. So we're very excited about that. Many of our providers have. So as we continue to open up even more, we're just looking forward to more and more enhancements. We're doing a lot of vaccine education right now with our patients, and are just looking forward to playing a role in providing the vaccine when that becomes available, when our capability to do that is available. In our residential programs, we continue to operate our men's and women's residents. We lowered our capacity due to COVID. We wanted to be able to make sure that all of our men and women could have single occupancy to really help to increase their safety. In our women's residents, we also have a COVID or an isolation wing in the event that somebody who lives with us does become ill. That way they can isolate, so we can drop off food to them, but they're not around others. We have had to use that one time. We've had 2 COVID positive cases in our women's residents and 1 in our men's. Other than that, there has been no spread. We've been incredibly cautious in those programs in particular, just because of the living environment, and have put any number of protocols in place to make sure we really prioritize safety. We paused intakes for a while, but have begun taking in new clients. And the staff over there and the clients have just been incredibly innovative in keeping people focused on recovery and active, even during lockdown, even during the ongoing stress of the pandemic. We had women who were sewing masks, for our volunteers over here in We Help, or sorting dog food and cat food to then give away in We Help, doing Zoom yoga classes, just all kinds of, things they were trying out to try to keep people focused, keep them safe, and keep them healthy. We're very pleased to share that we are implementing, and just as of February, implemented a mental and behavioral health program. We're providing individual counseling for patients in the health center, and groups, counseling groups for men and women in the women's residence. And so that just started in February. But because we know how integral mental health is to overall health, and we just know how much of a gap there is in the community around accessing affordable mental health, we wanted to step into that gap and provide that for our community as well. I'll pause there again and take any questions or reactions before I talk a little bit about what we think is on the horizon for We Help and what we're looking forward to.
Jen, there's a question in the chat from Rita. Would you like me to read it?
Yes, please, that'd be great.
Rita asked, among the sports teams, do we have heroes that could promote sound nutrition to kids? Fresh produce is the key to good health, and heroes are amazing role models.
That's a great question and a great suggestion. We have, we've got great connections with the Tampa Bay Rays. And so I think could pursue that a little bit more to see if we could find a champion or a well-known advocate that can help kind of push that message. It's not something we've done. It's come up around, could we do that, or pull in someone from the Bucks? But if anybody knows anyone, don't hesitate to make an introduction, because I would be happy to reach out to that person and get them involved. I think that's been our biggest barrier, is we just don't necessarily have the connection. We've got great connections at the Rays front office, but not necessarily with the players. So yes, if you know anyone, we would be happy to champion that initiative. Other questions? Okay, well, I'm just briefly going to share a couple of things that we are looking forward to, or things you might anticipate with regard to We Help as we go through the coming months. We know, again, as I talked about at the beginning, that the shift here in COVID is going to create some shifts in We Help. So as more people become vaccinated, as this federal legislation that recently passed begins to filter through communities, individuals receive stimulus, families receive the expanded child tax credit. There's going to be an infusion, we know, into local governments and into schools, which may result in grants and other things that we're not yet familiar with. And so as all of that begins to happen, as we head into the summer and the fall, we do anticipate some shifts in, just our numbers that I had mentioned. We don't think we're going to stay at 350 households per day, that we think the need will still remain high. It's so interesting because as I talk to the staff and We Help, just in passing, I'll say, oh, how are you? Were you busy today? And, any number of staff will say, yeah, not really. We only saw 340 households today. And it's just so interesting to see that shift where a year ago, it would be unfathomable. Like there's no possible way we could have served that many folks. And that it just has become so normal that I think, and even talking to Monica, she said to me the other day, she's like, oh, we were so slow last month. I think it was only like 300 households a day. I was like, well, I mean, that's still an awful lot of people. So we know that, the numbers and the need are going to stay really high, but maybe not as high as what we've seen. And we also know that, one of the things that was so special to our model pre-COVID was this element of choice. And so what the team is really working on is how to incorporate elements of choice while also being able to serve a much higher number of folks. We know that we can't serve out of the traditional client choice model. We can't serve 250 households per day. People would wait for hours and hours and hours. We just we're not set up for that. So what we're looking at is technology that may offer us the opportunity to do that. We call it like an Instacart for food pantries. There's actually a model for that. Other food pantries around the nation do that. We also know there's some hurdles to being able to implement and effectively put that in place. An inventory system that we would have to, be able to establish in a, sort of in a way that we don't have now, as well as making sure we're not contributing to the digital divide. We want to be sure that if we go in the direction of technology, that the communities we serve can actually access that technology and use it for these purposes. And so those are the things that Monica and team are really trying to sort out. So we've been talking about it for a while. And the reason we haven't moved it forward is that we need to know, that this truly is going to be a solution that creates access as opposed to creates barriers. But that's something that we are studying and that we're looking forward to possibly testing here in the coming months. We also, I mentioned a couple of these things. We have this new partnership with the Early Learning Coalition. We're excited about We Help and our new health education manager partnering more closely on food and health related education, knowing that food plays such an important role in our overall health. And so seeing what may happen from there. She's brand new. She started with us 2 weeks ago. And so we're all excited to see what her ideas and thoughts are on that. So you'll see more communication from us about food and health and how all of that links together. We're also looking at, you all know we've done some mobile distributions and pop-up pantries over the coming months. We've been responsive to that. So as people have called us and asked us, can you go here? Can you pop up here? Monica and team have figured out how to do that and have shown up. We expect to continue doing that. We want to be more proactive as opposed to reactive in that if we can, and think about, what might this look like if we planned a year's worth of mobile distributions? Where would we want to go so that we're going to places like food deserts where, people really lack access and there aren't other pop-ups or mobile distributions happening. So we really want to map that out and make sure that we are stepping into the gap and doing that where there are no other options. And with that, in terms of becoming more mobile and accessible, that's kind of the name of the game, is how can we be flexible? How can we be as mobile as possible? And how can we really get into neighborhoods to serve people where they are? And that's where new partnerships come into play as well. So Monica has really had an eye to building these new partnerships, and we look forward to her continuing down that track and finding new partners to work with. So again, that we can serve families and communities in their neighborhoods. Monica, what did I miss? Oh, Monica wanted me to share. We are going to be staying outside for the foreseeable future. We're not moving inside anytime soon for all kinds of reasons. We can't keep up with the volume that we're seeing. or that we think we're going to see if we move inside. And we also just want to be sure it's safe to do that. So when we start to do some of that work from inside the pantry, we want to be sure that it's at a time where it really is safe to have a high number of people in the building. So we just do not know what that's going to look like, and we don't know when that may be. And so what we're saying is, for the foreseeable future, we will be under the tent. There was a request in the last session to have some more fans out there, and I had shared that Monica is really good at putting together industrial fans. I've seen her do it. So we're going to have more fans out there. I think, Monica, are we getting misters?
We are. So we just purchased, and it'll be coming soon, a tent with misters. We'll have an area for you all to take breaks. We know summer is coming. We will also add an additional volunteer role, and that role will be the sole purpose of giving volunteer a mandatory 15-minute break. It's going to be super hot out there, to go around and kind of give everybody the chance to go inside, eat a snack, go under the mister tent, get away from everyone, and just kind of take a breather, because it will be hot. So we're working on it. I know you guys are a little bit worried, but it does get pretty hot. So we'll be working.
And I just want to share a couple of comments in the chat. Monica shares the Rowdy soccer team would do it. Rita says, get them on board. So we will. Monica will add that to her list, her growing list of things that she's working on. And thank you to Adam, who says the drive-through model is pure genius. I agree. I want to just, I know that you all know Monica well and know how incredibly talented and wonderful she is, but it was really, as a new CEO coming into an organization, as you can imagine, suddenly being faced with this, a pandemic that was going to really upend, everything that I thought would be happening in the organization, and my 30, 60, 90 day plan on what I was going to do. And knowing that had to go out the window. And I know a lot of leaders are faced with a situation where they have to kind of figure things out, for those on their team, and provide certain directives, and really have to have that direction. And that was not the case at the free clinic. Monica, her team worked together, and just from one day to the next, figured out how to completely change our model, and did so fearlessly. And, I think in the first week or 2 weeks, it was, okay, well, maybe we can stay inside and just have people line up outside, and we have 2 or 3 people come through the pantry, keep the choice model in place, have a few volunteers, keep it under 10. And we tried that. I think that lasted less than a week. I want to say maybe 3-4 days. And it was overwhelming, right?
3 days, 3 different versions.
3 days, 3 different versions. And we just couldn't keep up with demand. And so that it was, Shayna's coming to me and saying, okay, we have to move outside. Great. And so in those first few weeks, it was figuring out what's the right amount of food to put out there, and the right rotation and the assembly line. And just over the months, it got perfected. We knew as the summer months were coming, we needed to get a tent. And so Monica figured out how to get a tent, and then fans, and, just this constant perfection of the model. And then as the months went on, Monica would share in her monthly reports that we're down to being able to serve 1 car every minute or every 50 seconds, and so the efficiency just increased. And as you can imagine, on days when the line, and you all know, stretched down 3rd Avenue and down 8th, and was overwhelming. I mean, blocks and blocks and blocks of cars without a pause all day long. And so not only figuring out how to just innovate and significantly increase the number of people served, but their attitude and just absolute positivity throughout all of this, for me as a new leader, has been such a remarkable benefit. To know that, like, this program has such incredible leadership, such dedicated volunteers who continue to show up every day, that we could just do everything we did. So it is completely due to all of you here that we've been able to do this.
Some of you were even angry when I told you had to stay home for your safety. Rita, you had something to say. I know you raised your hand and don't want to miss.
So yeah, summer is summer in Florida. You can't do anything about that. That's just our reality. Is there any consideration of maybe starting earlier some days? I know we start pretty darn early to begin with, but maybe starting a little bit earlier on a couple days, because even though we have the benefit of having the tent and all that, people are going to be sitting in hot cars. So they're going to be sitting out in the heat. So, you know, possibly starting earlier. And of course, we've got time to think about that, maybe get the word out. And the other thing is possibly maybe having 2 evenings a week, because it's light later. And, you know, maybe possibly doing that. And that would give people who are the working poor not a chance to get there after work. Because right now we only have 1 day a week. I don't know what your numbers look like on Thursday evening. That's when I used to volunteer, but I'm a Monday morning person now. But there might be some of us that are, you know, are pretty gung-ho and willing to, you know, roll out a little earlier and maybe get some of these folks taken care of before it gets to be the hot time of the day. So
It's
just
definitely something, absolutely, definitely something to think about and take into consideration. We are talking about how we can mitigate and even shortening shifts or changing things. So I will bring that up and absolutely talk about that with the staff. Thank you, Rita.
You're welcome.
Other questions, thoughts? Well, I just want to thank you all so much for taking the time to be here this morning, certainly, and to have this conversation, for taking the time, you know, allowing me to share a little bit about what's been happening and what we see ahead. But more importantly, for the years and months and weeks and hours that you all have dedicated and continue to dedicate to our mission here at the Free Clinic. I shared this in the last session we had here, and I'll share it again. I'm a nonprofit veteran. I've been in nonprofit leadership for a little over 20 years. And I've worked for a lot of organizations that talk about volunteers. Oh, you know, they're the lifeblood of the organization, and we couldn't do what we do without volunteers. And in some organizations, volunteers are important, but it's sort of just a thing that organizations say, knowing that they're not, you know, really maybe central to the mission. Here at the Free Clinic, it could not be more true to say that the volunteers, our volunteers, you all are the lifeblood of this organization. We quite literally could absolutely not do anything that we do without all of you. Our staff is incredibly lean. You know, as you know, out on the line, it's a couple of staff members and 10 to 12 volunteers. Without fail, 2 shifts a day or 3 shifts a day on Thursdays, every single day. So the fact, and in our health center, you know, our physicians are all volunteers, and our mentors in the residences. We could not do what we do without you. You are the reason that we have been able to step up, to respond to this community need during COVID, and to do the incredible work that we do. So I could not be more grateful. I am just so happy to get to know all of you. I'm here every day, Monday through Friday. So if you're around and I haven't met you, or you just want to chat, please feel free to drop by. And I would love to just get to know all of you more. But thank you so much for everything that you do. Okay. And then we have one more comment from Adam here before we close, who says, as a former manufacturing plant guy, would like to commend the drive-through staff with excellent EHS processes, especially the forklift safety. Thank you so much for that. Safety is so important in so many ways. We're so glad that that's your observation. Thank you. Thank you.
Yeah, Adam has, like all the new volunteers that we brought on, especially during this COVID crisis, and our veteran volunteers just dive in so 100%. I just wanted to add that to your comments, Jen, about the difference that I've seen in the volunteers here versus in other organizations where I work, is that this sort of just full embracing of our mission. I'm feeling it with your heart and soul, and it shows in every single day in the work that you do. And Adam is a great example, because he was here 2 or 3 days before he had like 3 dozen ideas about cool things that we could do. And I love that our volunteers get to be so active and participate so actively in what we're doing every day. So it really sets you apart. And I just wanted to, Adam reminded me of that thought, and I wanted to make sure I said thank you when I mentioned that.
Well, thank you all so very much. I hope you have a wonderful, restful, restorative weekend. And I look forward to seeing all of you hopefully sometime soon here in WeHelp.
Thank you, Jennifer.
Thank you.
Thanks so much.
Thank
Take
you.
good care.
Thanks, everyone.
Thanks, everybody.